I'm Dr. Bill Berman. I'm the Director of Public Health at Denver Health. COVID in Denver continues to improve. The average number of cases today is 111. To put some context around that, that's down 30% from a week ago. So continued improvement. The percent of tests that are positive continues to decrease. It's 2.9. And we think below 5 is good and below 3% is very good. So that's good. And then I'll say that vaccinations are going well. So about 12% of Denver's population has started the vaccine series, including, importantly, a whole lot of DPS staff. So we're happy about all that. Yeah, the one thing we can say is that it will affect quarantine. So when someone has completed both doses of the vaccine a week or two after that to make sure it has its full effect, then individuals who are exposed to someone will not need to quarantine. So we confirmed that with the state, and then that follows CDC guidance as well. So that's great news. The DPS 5, the answer for now is no, it won't change the DPS 5. DPS staff are issued high quality masks. And so they would certainly fulfill the criteria that is in CDC's enhanced mask, perhaps that's the way to say it, guidance. And there's no need to add something on top of the KN95 masks that are being issued to staff. So first point. The second point, I haven't changed my thoughts about double masking for kids or for students. And that I think we should keep our focus on assuring that a mask is on and on correctly, and in really thinking through those situations in which masks are off to minimize the risks of transmission at those points. I think that is a much better use of our time and effort than worrying about double masking. Well, I always want to distinguish between two kinds of testing. So one is diagnostic, and that's a person with symptoms. And absolutely, what I want to emphasize is that testing is widely available, free, should be convenient. And so we want everybody who has symptoms to be tested. When vaccination has been completed in a month from now, should people continue to be routinely tested as often as every week or every 2 weeks? I don't feel strongly. The data we have suggests that the yield of routine testing, screening testing among people who've been fully vaccinated would be very, very, very low. So I can understand a move towards doing it less as we have people complete the vaccination series. A student or a staff member who is ill enough to be home, if those symptoms are in any way reminiscent of COVID, we want them to be tested. Because by the state guidance, an individual who is home with symptoms that are suggestive of COVID and has not been tested, if we don't get that testing completed within 4 days, we treat that as if it was a confirmed COVID case, as we quarantine. And so really it's important that both parts of that advice are important. If you're ill, stay home and be evaluated. And if there are symptoms that are in any way suggestive of COVID, be tested.